Welcome back in another very interesting discussion. Today we will discuss a very interesting image that we have seen recently in our OPD. It's a classical case of pneumatic consolidation, and classical description of pneumonia is a hepatization, where what happens in the pulmonary parenchyma or lung tissue is replaced by a tissue that has a consistency similar to your liver because of the inflammation and inflammatory exudates that they fill the air spaces. So today we will see one of the very beautiful, very classical looking CT picture of a pneumatic consolidation. How does it look like on a CT film? So let's start. So this was a case of left lung consolidation where CT scan was done and there is a CT abdomen to compare with the consistency of consolidated lung with that of liver. So let's start, and this patient has just I would like to share the brief clinical history. This was an elderly male, a known case of COPD. He came to our OPD with complaint of fever for 2 weeks, cough with expectoration for 2 weeks, and he was also having shortness of breath. This patient was investigated outside and straight away a CT was done, and he came with us with this CT. Here you can see this is such a beautiful area of consolidated left upper lobe. This is your right lung, this is your left lung, and this is the area of left upper lobe. Entire left upper lobe is consolidated with air bronchogram sign. Here we can see air bronchogram sign. This is a classical air bronchogram sign seen in consolidation. Alright, so what is air bronchogram? Air bronchogram is airways containing air surrounded by your parenchyma, pulmonary parenchyma with consolidation. This is classical. Here is one air bronchogram. This is a sign of air bronchogram. So this is classically seen in your pneumatic consolidation. Alright, so if we see here in the chest CT film, this area left upper lobe, entire left upper lobe is consolidated and is exactly looking like your liver here. I have just seen this image to compare. In CT abdomen, liver is of this consistency, and here in our patient it is looking like similar to liver, just like giving appearance that liver is sitting on the lung. Alright, so this is a very classical presentation of pneumatic consolidation and beautifully seen here. So what is hepatization of lung? It is nothing but hepatization is a conversion of a substance resembling like liver. Okay, a state of the lung where engorged with effusion matter, inflammatory exudates, so that they are no longer pervious to the air because the air is replaced by your inflammatory exudates and inflammatory cells and dense enough to give a consistency like liver. So this is called your hepatization of lung, and classically it is seen in lobar pneumonias. Alright, and we know that in the pneumonias it is also described as a red hepatization, grey hepatization, and the resolution. So this is a very classical presentation, classical picture of CT scan of left upper lobe consolidation that I wanted to share among all of you.